specific question regarding this longer syndrome. Certainly, there have been some reported cases of putative relapse, so people have fallen sick again, and a lot of work is going on to see whether people have been reinfected or whether it's just a chronic part of a condition. The people who leave hospital are free of the virus. They're usually testing negative before they depart hospital. But I think what we have to remember is many people who've been hospitalized have experienced severe disease. And while they may be free of the virus and no longer infectious, many are experiencing longer term issues with energy. They've literally been through the wars, many of them in very difficult circumstances. Some have had impacts on their respiratory system, their cardiovascular system, their liver, their kidney function, and others. So people could remain quite frail, quite without energy, and struggle to get back to full health. So we have to separate here what is a long struggle to get back to full health from what might be a continued COVID-19 syndrome where you have persistent virus. And the evidence thus far is that there is very little evidence to suggest that there are people who are persistently suffering from COVID-19. Although when you see the data from the hospitals and the length of admission, it is taking many people a very long time to recover in a hospital environment. And we should expect that when people are discharged, that recovery continues. And people don't necessarily just bounce back to full health. Although when they are discharged from hospital, it is safe for them to return for themselves and their families.
Studies with serologic tests in several countries. I'd like to know how high is the prevalence found in those studies, and as far as the percentage of people who had contact with the virus is below the level of the so-called herd immunology, if having a higher prevalence protects more than having a lower one, given a certain population. There is, for instance, a country or a region with 30% of the population that already have been infected. Is this population more protected to tackle a second wave than another with, let's say, just 5% of prevalence? Thank you very much.
There are a large number of countries that are conducting these seroepidemiologic studies. We are tracking them, and there's more than 90 studies that are underway. Some of the results of the early studies are now starting to be published. I say published. One of them has come out in a peer-reviewed journal. There are a few others that we've seen as preprints, which means they haven't undergone the full review, and a number have also released results as press releases. I say this because it's important because we aren't able to critically evaluate all of these studies yet. What is interesting from the studies that are coming out is that many of them across a number of countries in Europe, in the United States, in Asia, have found a very low proportion of the people that have been tested have evidence of antibodies as measured by these serologic tests. And the range is between 1 and 10%. It depends on the study. It depends on the assay that was used. There are a couple of studies. I haven't seen the full studies. We haven't evaluated them. That suggests it's a little bit higher, maybe 14, 15%, but we haven't seen the full studies. And again, I say that because we need to understand which populations were studied, which serologic assays were used, so that we could really understand what the results mean. Having said that, there seems to be a consistent pattern so far that a low proportion of people have these antibodies. And that is important, as you mentioned, because you mentioned this word herd immunity, which is normally a phrase that's used when you think about vaccination. When you think what amount of the population needs to have an immunity to be able to protect the rest of the population. And that level, we don't know exactly what that level needs to be for COVID-19, but it certainly needs to be higher than what we're seeing in some of these seroprevalence studies. What the seroepidemiologic studies indicate to us is that there's a large proportion of the population that remains susceptible. And that's important when you think about what may happen in subsequent waves or what may happen as a potential resurgence. And so we have a long way to go with this virus. because the virus has more people that can be infected. Having said that, we have the tools in our toolbox to be able to prevent this virus from taking off again. And we know that that's about finding the virus, finding people with the virus, isolating them, caring for them appropriately depending on their symptoms, making sure that we find all contacts, trace those contacts, quarantine them so that they don't have the opportunity to transmit further, make sure our population is fully engaged so that they know how they can protect themselves and how they can protect others. So we do have tools at our disposal to be able to prevent transmission from happening further, and